I'm always honored to participate. We have a wonderful crowd here again, and the members that join us on the phone, usually a very lively bunch with great questions. And it's a privilege to be a part of this, and it's an honor to serve. I've been very fortunate. I'm entering my 20th year in public office. This is the only office I've ever held. I was elected in November of 1995 and have really been very honored to do this job and to represent all of you and to represent the interest of the people of the state of New Jersey. And I was very fortunate to be introduced to government public service through the legacy of my mother, who served with such honor and distinction for 20 years. She was the first woman to be elected mayor of Cherry Hill. She was the first woman to ever run county government in Camden County and the first woman to be elected surrogate. And it's been an absolute honor and tribute. She was the greatest role model in my life, and to have the opportunity to serve in her memory is very rewarding.
We would be remiss if we did not thank you right now on this AARP forum for being one of the supporters of the CARE Act here in New Jersey, which is a bill designed to help family caregivers in their interactions with hospitals and to get just a little bit more recognition and support from hospitals in the caregiving duties that over 1 million people in New Jersey do every day, caring for their loved ones.
We now have to work on how do we deliver that health care for them, where many of them don't have primary care physicians, and we need to avoid that direct pipeline to higher cost settings with lower quality outcomes directly to hospitals and have that care more closely aligned in the community with your primary care doctors and save hospitals for the right setting at the right time for the appropriate care. And that's a big reason why we did the piece of legislation that Doug talked about to provide for that caregiver support so that we don't have the relapse of patients going back to hospitals, driving up costs.
AARP also supports a caregiver's tax credit, which is being sponsored by Assemblywoman Lampett, your co-assembly member from your legislative district. So we appreciate your support of that tax credit for people. That would no doubt help Betty's son as well to cover costs that they incur. Another issue raised by Betty is the notion of long-term care services and supports. AARP strongly believes that the state should do more to provide services for people in their homes and communities.
This is a piece of legislation that makes sense. There's no cost accrued to the state for this. I think it is really about a conversation about redirecting the delivery of care to lowest cost settings where we can get higher, more quality outcomes. And I think that's the direction that, regardless of Republican or Democrat, you look at.
Let's next go to a question about caregivers from Laura in Cherry Hill. Laura, you're on the call.
Yes, good morning, Assembly Greenwald, and to my New Jersey residents. My question regards with community service providers. My daughter was recently moved back to New Jersey. She got caught up in the Return Home New Jersey program and has moved into this group home in which they hire people that really are in difficult positions. They're lovely women that work there, and they work very hard. But unfortunately, a lot of them are poorly educated and minimally trained and put in very challenging positions. And I was wondering if perhaps legislation could be developed in order to require some kind of certification process for these employees, because the only thing that's required by the agencies now is a high school diploma or an equivalency.
This is an interesting discussion point because we are going to see more and more care be redirected to facilities like this, and to make sure that as we see a growing number of residents that are going to be utilizing this, we're seeing residents age with greater dignity. We're seeing a larger number of New Jersey residents with disabilities. We're seeing a national trend to facilities like this. We need to make sure that the skill sets of the workers are keeping track and balance with the needs of the residents, along with the cost structure. You know, I always tell everybody it's not fun to have these conversations, but there's a balance of, what are the needs and how are we going to pay for those needs, and what is the impact ultimately going to be on the consumer of the cost for these certifications and these services. So we want to make sure that we get the right spot of need for providing the care to the residents in these facilities, make sure that the people are trained appropriately, and that the cost structure is aligned so that the families can continue to afford.
Well, my issue is I have 2 adult children who unfortunately have to live with me. My daughter has Down syndrome, and my son had problems from a surgery from when he was graduated high school. And so, unfortunately, the kids are with me. Now, they're on Medicare and Medicaid, but I just got a notice from Horizon Total Care that they are dropping my kids as of January the 1st. And I have to search for another insurance to cover my children.
Well, I would ask you to, even if today or tomorrow, stop into our office and let us take a look at your children's case and understand why their policies have been canceled. We have relationships at Horizon. We have former staffers that now work at Horizon, and we can certainly reach out to them and see if we can help.
Thank you for answering some really huge, tough questions, and for being not only the Assembly Majority Leader, but a leader for seniors and people who in many ways are struggling to get by. And last but not least, I hope we will see you here again, perhaps in January, February, for another Teletown Hall Forum.
Sure.
Thank you, sir.
Thank you very much.